You know, it wasn't that long ago that many people said no thanks to having their hips or knees or shoulders replaced. The surgeries were difficult, recovery times were long, and the outcomes varied. But as Steve Shaw reports, so much has changed and is resulting in more and more Oklahomans adopting an out with the old and in with the new attitude.
Tony Fiorentini is a former golf pro who managed the municipal golf course in Las Vegas for 25 years. 2 years ago, when he and his wife Yvonne retired to Edmond, dull, constant arthritis pain he dealt with in his knees for years had morphed into a roar.
I guess that sums it up for me. I just lived with the pain for a long, long time. And finally, I said, I've got to get this fixed.
So on September 24th, Fiorentini had both knees replaced at McBride Orthopedic Hospital in Oklahoma City.
To get it over with. To realize that pain in both knees was there. They were only getting worse and worse.
Fiorentini says he's glad he got both done at the same time.
It was tough. The first month was pretty tough. It was pretty rough. Couldn't have done it without my wife being here. It would have been impossible. She had to literally lift my legs up on the bed and help me down and help me get dressed and everything. So I couldn't do anything.
Do things that only a spouse?
Yeah.
You know what I'm saying?
Yeah, oh yeah. She learned to love me even more.
Dr. Thomas Takash performed Tony's surgery.
Pre-COVID, okay, let's throw COVID out of the whole deal. Up until the COVID, had you noticed like an uptick in patients, like the numbers of patients wanting to get these very serious procedures done?
Absolutely. The baby boomers, the baby boom generation is now becoming of age where most of those people are wearing their hips and knees out. And so, yes, there's a huge number of people in the United States that are in that age group that are going to soon need hip and knee replacement.
Takash says a big reason for the huge uptick in joint replacements is the plastic and ceramic materials used are now much better. Artificial knees that used to last maybe 10 or 15 years now last as long as 25. Artificial hips can last as long as 40 years, which is good news for pain sufferers like Monsignor Patrick Glass, who's pastor of St. Bernard's Catholic Church in Tulsa. He had a hip replaced at the Center for Orthopedic Reconstruction and Excellence in Jenks little more than a month ago.
5 days of the surgery, I was making announcements in the church, climbing the steps into the pulpit. It rather frightened some of the parishioners, but I was perfectly comfortable with the surgery that I'd had and the physical therapy instructions I'd received.
Dr. Yogesh Mittal performed that surgery as well as 350 other hip and 850 knee replacements each year.
We got to use big instruments, big tools, power tools, but you really had the opportunity to make a difference. You could fix somebody, not just give them medicine, but actually fix somebody, and then they could recover and move on with their lives.
Another reason joint replacement is now more common is the anesthesia now is much better.
Gives people a much more pleasant experience post-operatively. So you have much less pain with the type of nerve blocks that we use now, which we didn't do years ago. So that, I think, is a big advancement.
Dr. Takash says joint replacements have a 98 to 99% success rate.
It is about getting your life back. That is about what this operation is truly about.
McBride surgeon David Holden gave me my life back 3 years ago when he replaced first my right shoulder joint and then my left a year later. Osteoarthritis pain will eventually kill you if you let it. Holden is a joint replacement pioneer. He's replaced literally thousands of knees during his 30-year career, and he was one of the first U.S. surgeons to perfect what are known as reverse shoulder replacements. He's done more than 1,500 of those, including mine.
In shoulders, we are vastly better than we were 20 years ago. We've had shoulder replacements since the 70s and the early 80s, but our technology was poor, and they didn't last very long. A shoulder replacement might last 7 years. And that made people real reticent to use them or to do them.
Holden says COVID-19 has slowed the number of surgeries at McBride.
So we are having to modify and limit some people and put them off because they're risky or they might have higher risk. And normally that wouldn't be a big problem. But today, if there are no ICU beds, we can't take the risk of perhaps having a complication, which we have very few of, and having no place to go.
Tony Fiorentini is grateful he got in when he did.
Yeah, no more arthritis, no more bone on bone. It's getting better literally every day, where before it was getting worse every day.
Steve Shaw, the Oklahoma News Report.